The number of uninsured citizens in Connecticut is set to drop like a rock. Prior to the Affordable Care Act, an estimated 8% of the state's 3.6 million people were chronically uninsured. People like Margaret Higgins.
Before, I could not afford my medication, but now I can. I make my doctor's appointments and I'm able to keep them because I would have to cancel at some point because I thought I would be able to get medical and I couldn't, but now I can make the appointments, keep the appointments, get my medication, and everything is, I have a peace of mind now where I didn't have before when I had no medical. It's a load off my shoulders.
The Connecticut Office of Healthcare Advocate developed and oversees the Navigator, an in-person assister program known as NEPA.
I think it's kind of unique. The people running our program are people who have lots and lots of experience in their communities, who represent diverse communities, who speak multiple languages, and those are the exact audiences and exact members we need to reach in Connecticut. So I think it's been a tremendous success by all accounts.
NEPA is a key part of Access Health Connecticut's efforts to build community connections and a permanent community structure for rolling out the Affordable Care Act.
Access Health CT is one of the top enrolling exchanges in the country. So we've already hit our mark, and this is February. Our goal for the end of March was to enroll 100,000 individuals, consumers, and we've passed that goal.
So how do you find 288,000 uninsured people out of millions? Old-fashioned community organizing. Connecticut was divided into 6 geographical regions, each with a single navigator. The mission? To develop an army of 300 diverse personal assisters, allocated by need, who had a passion and history for the cause, who knew their communities, and who would knock on doors and staff enrollment events like this one.
It's been very intense and very busy. As you can see, today is our wedding anniversary, 14 beautiful years, and we are here committed to the cause.
The opportunity to become assisters for our city came up, it fed right into our mission, which is, our mission statement at the church is making ourselves better in order to make others better. If we're not healthy, if we don't have proper health care, if we're afraid to go to the hospital because of bills, if we're afraid to go to our doctors because of bills, then how are we going to be able to live a healthy lifestyle?
Well-known community nonprofits were encouraged to apply, as were churches, faith-based organizations, and small businesses. They met once a month to track their progress, share success stories, and refine best practices.
It was a very strategic approach where we placed the assisters, which organizations we gave grants to, and also making sure that those organizations, their mission was aligned with our goals.
Each assister was given extensive training lasting more than 40 hours around the key words: educate, engage, and enroll. This included 6 online tutorials, along with 6 quizzes requiring an 80% pass rate before they attended a 2-day training session, which was by invitation only. NEPA organizers made sure there would be no language barriers, making arrangements to communicate in 32 different languages.
I think they chose organizations that know their community very well, have worked closely with these clients and met them at other needs, and they have been able to easily trust who is guiding them to get this insurance because they already know them. They're comfortable with these organizations that have been around many, many years in New Haven, or us who've been around 4 years, but we have been able to meet them at another need, and they know they're comfortable enough to come to us to guide them the right way for their insurance.
Access Health CT hoped to enroll 100,000 by the deadline. They've been wildly successful.
So we've been able to help pastors be able to get health care, which has been super excited for us, because this is what we're talking. This is what organizing is about. This is what we believe this assister program is about. It's about organizing a community, organizing a people, organizing a nation to come together and say, listen, we have an opportunity here, and if we don't go and tell people about the opportunity, then it's shame on us.
At last count, the number of those enrolled was nearing 200,000, and there were still open files being processed and completed. A majority of the new enrollees are believed to be the uninsured organizers had hoped to find.
To be told that, Connecticut has really exceeded their goal has been very self-satisfying because we are meeting people at their insurance need.
I grew up doing community service. My grandfather, he was very big in the community, especially in the north end of Hartford. He was always giving back, and that's something that he instilled in us. I didn't always have health care coverage myself, so it's rewarding to be able to see someone walk out of an enrollment fair and they're smiling. They come in and they're a little nervous, and then when they walk out, and you can really see the pressure, their shoulders are lower because they have that peace of mind. I love it. I do. I really do.